Today we're looking at a review of the cervical joints, so apophyseal joints, unconvertible joints, and the intercentrum joint, that is the disc and the vertebral bodies. And then we'll be looking at the mechanical interplay between all three, and then the assessment of each of the mobile joints, that is the facet and the unconvertible joint. A quick anatomy review. C2, C3, C4. The uncinate process is sitting there and here. It's here, and then down here it's hidden by that costal arch there, the costal element of the transverse process there. The disc sitting there and there. Didn't get this one in, and sitting here. Now there's some interesting bits of this. For example, the disc in the cervical spine is absolutely nothing like the disc in the lumbar spine. This is homogeneous. By the time you're about 30, this is completely homogeneous, and it looks more like a symphysis than an intervertebral disc, because the nucleus is actually quite small compared to the lumbar nucleus in relative terms. So it takes up about 1/3 of the volume of the cervical disc, but in the lumbar spine it takes up about 2/3 the volume. So it already is small here, and then that nucleus disappears from the disc at every level except the lowest cervical disc, and it's either macrophage or it's resorbed into the symphysis as it becomes. So it's just an homogeneous mass. We don't have the lamellae that you see in the lumbar spine, just homogeneous. The uncinate processes are much more developed in the higher cervical spine than it is in the lower, and they're much more vertical. So as you go down the spine, they get flatter and flatter until they disappear at the bottom. So what you see is you very rarely see disc herniations from about C4 up, not posterolateral ones anyway. They tend to go straight posterior into the spinal canal, and that's because the uncinate process protects that posterolateral corner and directs any disc herniation backwards instead of laterally. So it's a completely different system, and the degeneration of this system is different as well. So in the next slide we'll look at the development of the structures, or at least the uncinate process and the discs, and the unconvertible joints, and then we'll look at the degeneration of the cervical segment. It's all sort of intermingled. The uncinate processes are not present at birth, and they develop in the first 10-12 years of life. So by the time you're about 15, they're fully developed, except for growing as the body grows. They are fully developed. So let's see if we can point out some of these features. There's the uncinate process sitting like so, and it articulates with a facet that forms there. And there's the disc. So the disc is actually the separator between the two spaces, the two vertebral bodies, and as the joints develop, the disc starts to break down, and what you see is a fissure that forms like so on each side. And let me see, then there it is. A bit fiddly this, and I'm not the fiddly type. So this thing forms by the uncinate process, and it goes backwards. So it would form about there and run back through the disc this way. And from each side it would run in like so. And then it would spread back. So these two fissures meet in the middle, like this, and then spread backwards to separate the top half of the back of the disc from the bottom half. So by the time you're around about 30, the back of the disc is completely split in two. Now in some cases that split will also go forward. In some people, in some segments, it will also go forward, and the disc is completely separated. So what it means is that as the disc splits, this now forms the articular surface of the unconvertible joint. So this is not hyaline cartilage, this is fibre cartilage, rough fibre cartilage now, and the outside of the joint, you get connective tissue forming a joint capsule over it like so. and this fills up with interstitial fluid. There may be some synovial inclusions in there, but essentially this is not a synovial joint. This is an interstitial fluid joint with rough fibrocartilage for the surfaces. Now, this is normal degeneration. The nucleus, which is already small, actually becomes less and less significant, and by the time you're around about 30, 28, 30, somewhere in there, it's disappeared completely. So what you have there is a fissured homogeneous mass that's like a partially torn symphysis, and this is normal degeneration, and that degeneration starts at around about 12 and it goes on. So the disc loses height, the vertebral bodies also lose height, but everything gets a bit squashed out and fatter, so they become wider but shorter, and that's normal degeneration of the cervical spine, and it comes from the development of these joints. The effect of the unconvertible joints is to change the mechanics of the segment entirely. Imagine two mixing bowls, represented here by the two curved lines. And this is what basically happens. We've got the uncinate process sitting up there and the other one sitting within them, the superior vertebra sitting within them. So if you push down on one of those mixing bowls, it not only tips that way, but it slides across to the other side. And that's what the U joints do here. As you side bend to the left, it slides over to the right. So that's the translation. One of the things it does, I guess, is to keep the neck vertical when you're turning your head. If this was to side bend in the same direction as your turn, you'd end up doing that. If it's side bend away from it, you'd do that. But this actually tends to keep it steady and still and vertical as you turn, keeps your eyes level. Let's look at flexion extension, denoted by symbolized by the two arrows above. With flexion, obviously, you're going to get an anterior osteochondric rock of the vertebra and an anterior slide as well. While the facet joint is going to, the superior facet joint is going to glide superiorly, actually supro-anterior. Extension is going to be the reverse. That is, you're going to get a posterior osteochondric rock and a posterior translation and an inferior glide of the superior facet. The little red arrows in there look at what's happening at the unconvertible joint, and we're going to model that as if it's on the axis of rotation and you're getting a spin there. The amount of movement does obviously occur there, like linear movement occurs there, but we're going to treat it as if it doesn't, because for the purposes of what we're talking about now, it doesn't matter. So this is our model for flexion and extension. Okay, so let's have a look at side flexion now. The left figure shows the bones. The arrow at the top is showing right side flexion, and what we see there is the right facet will glide inferiorly, that is extend. The right unconvertible joint will glide inframedial, which we can approximate as inferior. The left unconvertible joint will glide superlateral, which will model as superior, and the left zygapophyseal joint glides superiorly, that is flexes. And you can see here that that leads to left translation. And we go back to the analogue of the two interconnected bowls. Pushing down on one side, on the right side, causes the superior vertebra to translate to the opposite side. Take the bone off and we'll look at the joint movements, and what we see here is the movement of each joint with right side flexion. So again, we have an inferior vector, an inframedial vector, a superlateral vector, and a superior vector, and the resultant of all this is that left translational composite glide for all of the joints, and that's what you're testing when you're doing these P-PIVMs of side flexion, translation, inflection, and extension. You're assessing the translation, inflection, and extension. If any of these joints are hypomobile, that translation will reflect that and be hypomobile, and the end field will be off. Here are the facets somewhere. There and there. Here's the unconvertible joint. So we flex them. The facet joints slide superiorly. The U joints basically stay where they are as they're on the axis of flexion and extension, so we get that spin really there. As I say, we're going to approximate to that. There is some obviously movement, linear movement here, but mostly it's going to be spin, so that's how we'll approximate it. So the facets flex up, come up, and the unconvertible joints spin, basically. We then right side flex it. And you're looking at the back of this now. So when I right side flex, this facet simply drops back to where it was, but this facet has to go further, and it has to be able to stretch its capsule. This U-joint goes down and that U-joint goes up. So if we're looking at what can limit these movements, then we know that it can't be the right facet, simply because all it has to do is return to where it started. So it's not that one. But it could be either of the two unconvertible joints. After all, we're doing side bending, and that involves these two things moving. So that could be doing it, that could be doing it. Or it could be the left facet joint that has to go further into its flexion range than simple symmetrical flexion. So it could be this one. So the limitation of flexion, right side flexion, left translation could be by the contralateral facet to the side bending, or either of the two unconvertible joints, but not the ipsilateral facet, as that simply has to return to its original, more neutral position. Okay, now let's look at extension, right side flexion, left translation. So again, here are the facet joints, here and here. Here's the unconvertible joint. So this time we'll extend it and the facet joints move inferiorly. And again, the U-joints basically spin. Now we're going to right side flex it again. And this time, this joint on the right side, the right facet, has to come and push its facet further down, whereas all this facet has to do is move back up to its original start position, or near enough. This one still has to go down, and that one still has to go up. So this time, what we can see is that the joint that can't limit the movement is this one, simply because it simply returns back to a more neutral position. But this one can limit it if it can't go up, this one can limit it if it can't go down with a side flexion, and this one can limit it if it can't flex to its full extent. For whatever reason, it could be the other two U-joints, or it could be in and of itself. So we know when extension, right side flexion, left translation is limited, it's the ipsilateral facet, or one or both of the unconvertible joints. And now right side flexion, left translation in neutral. So again, here's the facets, here's the unconvertible joint, and we're going to do right side flexion. So we right side flex, this joint goes down on the right facet, the right unconvertible joint glides down, the left unconvertible joint glides up, and the left facet joint glides up as well. So now if we look at what could be limiting that movement, it could be that one, that one, that one, or that one. Any of them basically. So doing this test in neutral doesn't really give you any information other than one of the joints is in trouble. And it doesn't say anything about which one. But by putting all of this together, we can decide which ones we want to look at in more detail. So let's just look at right side flexion is limited in flexion and extension now. So what does it do? There's our facets. We'll do flexion first. And we flex, they both go up that way. We right side flex, this one returns to where it needs to be. This one has to stress the capsule. This one has to be able to go down. That has to be able to go up. So what we can say, it's one of those three. As we said, that one, or that one. Now, we'll look at extension in here. So I extend, the facets come back and down. I now right side flex. This one has to come up. This one has to stress its capsule a bit more. This one goes down, and that one goes up. So if it's limited in both of flexion and extension, right side bending, left translation, both flexion and extension, then it could be either of the facets, or it would have to be both of the facet joints, one limited flexion, one limited extension. That's not very likely. So given that, the probability is that it is either the left U joint, if I can get the right colour, the left U joint or the right U joint. So we come to the conclusion that if the same side bending is lost in flexion and extension, it has to be one of the two unconvertible joints. Almost certainly, not absolutely, definitely, but almost certainly. And it would make sense to test the unconvertible joints before you look at the facets in this case. So what we can say is that the facet joints, the zygapophyseal joints, are flexion and extension mechanisms. They can only glide up and they can only glide down. If I side bend, then one goes down and one goes up. If I rotate, it's equivalent to side bending, so again, one goes down, one goes up. That's what they do. They flex or extend. The unconvertible joints, on the other hand, do two movements. They side bend, which is the one we've been concentrating on here. So I right side bend, the right one goes down, the left one goes up. But they also get involved in rotation. And this is with anterior and posterior glides. If I rotate to the left there, then the right one slides forward and the left one slides back. Now we're going to utilize that for manipulation, but not so much for the assessment. We're using side bending for assessment, but you have to remember that rotation and side bending are equivalent. They're not identical, they're not the same, but you can't have rotation without side bending, you can't have side bending without rotation, other than at C1, 2, and it's debatable then whether or not you can do that. You can argue about the shape of the joint, but that's a whole different argument. But rotation and side bending are coupled. Flexion extension, on the other hand, are not. These can be pure movements up and down the joint. So, by figuring out how these movements are restricted, we can know which joint we'll look at next. So, if we've lost flexion and not extension, the side bending translation in flexion, not extension, then we know pretty much that it's going to be a facet joint problem. And it's going to be a flexion hypermobility at one of the other zygapophyseal joints, and we know which one it is by figuring out which one has to flex more when I side flex. So I bend forward, right side bend, and the left one has to go into full flexion while the left one comes out of full flexion. You can't gain full range of flexion or extension symmetrically. You have to unflex one to get the other one to go into its full range. On the other hand, if side flexion is restricted in both flexion and extension, this isn't a flexion or extension loss, this is a side flexion loss, which means that it is the unconvertible joint that's in trouble. And given all that, we can then figure out where's the best place to start our more specific exam from the P pivot. So both movements are restricted. You look at the U joints first. One movement, flexion or extension, you'll look at the facet joints first. There is a bit of an exception to this, especially lower in the neck. Where these joints are not very well developed or they've atrophied, then in flexion they can disengage and then engage again in extension and neutral. So you may well find that there's a facet joint problem showing up in extension side bending that's not showing up in flexion. So you're going to go ahead and assess the facet joint with specific glides and find that's essentially negative. That will then take you back to the unconvertible joint, and there's your exception to it. Okay, so we can look at putting together some sort of flow chart here. And we start off with the diagnosis of biomechanical dysfunction of cervical spine. We then do the P-PIVM, side bending, translation, inflection, and extension. And we find that they're positive, all right? And we move on from there. If they're negative, then you have to wonder what's happening. Either the diagnosis is wrong or your P-PIVM abilities are not that great, but there's something wrong, so you have to review what you've done and consider you've made a mistake somewhere along the line. On the other hand, if the P-PIVMs are positive, we can move into it. Now, we're going to assume it's right side flexion, left translation again. And if we find that inflection, we then do a PAVM for the superior glide of the left zygapophyseal joint. If only right side flexion, left translation flexion is positive. If, on the other hand, right side flexion extension is positive, then we'll do the PAVM for the inferior glider of the right zygapophyseal joint. If they're both negative, then we'll look at the PAVM for the inferior glider of the right joint. And if that's negative, simply because that's the more common one, the ipsilateral one. If that's negative, then we'll look at the PAVM for the superior glider of the left unconvertible joint. If right side flexion translation is limited in flexion and extension, we move to the PAVM of the inferior glider of the right unconvertible joint. Again, it's usually that one that seems to be in trouble more than the contralateral one to the side bending. And then if that's negative, we'll do the PAVM for the superior glide of the left unconvertible joint. So this gives a sort of a framework or a system for making sure you're not missing anything with this. And you can see, even if you make a mistake with the PAVM, either picking up stuff that's not there or not picking up stuff that is there, you end up doing everything anyway if you have to. You've got that fallback where you'll come back and do the other joints and not take the PPIVM as gospel. Okay, because there are exceptions to this and you need to take those into account. There you go. A very quick review on the development, biomechanics and assessment of the unconvertible joints and the zygapophyseal joints. And if this wasn't a review, then go back and look at all the material that you got in basically in module 2. All right, guys, I hope it helps. You take care. Bye-bye.